Hi, my name is Dr. Evan Peskin. I'm an anesthesiologist and an interventional pain specialist at Insight Pain Management. I just joined Insight recently, so I've just been lucky enough to be part of the Insight family for a couple weeks now. I grew up in Cleveland, Ohio. I lived in Miami, Florida for the last 15 years where I did a lot of my training and specialization, and then I just moved to Michigan. I'm married for 4 years now to a beautiful, funny woman named Abby, and I enjoy greatly what I do. I completed all of my training, all 5 degrees at University of Miami. I did my undergraduate there, where my degrees were in psychology and biology. I completed my medical school at University of Miami. I took a year off during med school to get my business degree, where I completed an MBA in health policy management. And then I completed my anesthesia residency at University of Miami, where I was lucky enough to be exposed to trauma anesthesia, neuroanesthesia, pediatric cardiac anesthesia. I had some wonderful, wonderful experience, and I'm very grateful for my time there. And then I completed my pain management, interventional pain specialty and fellowship at University of Miami as well. So all in all, I was at University of Miami for about 14 years. I think my job as a pain management specialist is really the best job. In a nutshell, what I am lucky enough to do is have people experience less pain and hopefully give them a better quality of life. What I really like most about my job is I get to meet people from all different backgrounds, all different specialties, different careers, from all over the state, from all over the country. And at the end of the day, my job is to give them a better quality of life, make them happier, live with less pain. I think everybody has the experience of living with chronic pain at one point or another, whether it's pain associated with aging, pain associated with injury, pain associated with surgery, pain associated with illness, with disease, and I'm really lucky enough to hopefully make a difference and have people live with less pain. My best career lesson over my training and my experience is that Rome wasn't built in a day. Chronic pain did not develop in a day, and you can't expect to treat or solve chronic pain in a day. It's not a sprint, it's a marathon, and I am honored that I get to run it with so many people. I think because of the opioid epidemic, people think that, pain doctors and pain management specialists train for years and years just to write a prescription very quickly. And I think what many people would be surprised about is most of our training, we definitely deal with medication management. We definitely deal with all different types of pharmacologics and different medications. But our specialty, what we are really good at, is interventions, is nerve blocks, is epidurals, is pain pumps, is spinal cord stimulators, and neuromodulation. The world of pain is a really broad, complex field, and I think you'll find there's something for everyone. What stuck out to me for Insight is how genuine and how passionate and innovative Insight is as an organization from every level, from the top down and from the ground up. You'll find that every single person you meet, the different departments, the different specialties, all have one focus, which is patient. I think the 3 words that best describe me are enthusiastic, genuine, and curious. When I'm not at work, I'm lucky enough to be involved with some other businesses as well as running a nonprofit aimed at helping feed people in need. I really love spending time with my wonderful wife. I like to bake and cook. I like to run, play soccer, play tennis and racquetball, and work out. I enjoy reading. I enjoy watching comedy movies, really comedy, stand-up comedy, anything along the lines that makes you laugh. Life is serious enough. And I enjoy trying to challenge myself, find new things.
And so the word on the street is that you actually were or are a stand-up comedian. Is that true?
I was lucky enough to perform stand-up quite a few times. I enjoy it immensely. There's nothing better than making people laugh. I think it all stemmed from my father is my hero growing up, and he was very much a straight-faced guy. Getting him to laugh was just the best sound in the world.
Okay, so on that note, could you make me laugh?
Yes, again, the hardest part about comedy is modulating and reading the room. So it's about telling a joke that gets people to laugh without offending them, especially when you're being recorded, is the trick. So let's think I'm gonna get something that's hopefully PG-13. Give me 1 sec, let me find something that's the medium here. And then I will make you laugh, Suraj. There's no question about that. Let me find one that's not gonna get me fired. Okay. That would get me fired. That would get me fired.
Okay,
That would get me fired.
This is you made me